I was thinking about the overlap between the anxiety around eating and irritable bowel syndrome, and how it would be very difficult to tease out the symptoms. Are these related to, manifestations of the eating disorder, or is this true irritable bowel? And thinking about how many people are encouraged to explore food sensitivities, which then encourage restriction of food. Can you talk a bit about that?
Yeah. And so the GI stuff is so interesting because it's a chicken or the egg issue, right? Like if you're having GI symptoms that you feel discomfort when you eat, your natural response would be to adjust the way that you eat. And that's a very logical thing to do. But then you can feed forward into exacerbating that condition.
Hmm.
And I do think a lot of irritable bowel syndrome is disordered eating.
Mm.
I've seen that over and over again, and maybe my sample size is skewed, but I do think just from the even the things you see just in the general population on social media, what people are talking about, I don't know that we dig deep enough into someone's nutrition habits when we're assessing their GI function. I think there's just sort of this assumption like, oh, your weight's okay, so you're probably eating okay, move on. Now, if someone's obviously very underweight, that may prompt more questions, and that person may be identified and diagnosed. But I think the people whose BMI is in like the normal or overweight category, it's sort of assumed like, oh, you're probably fine. It's not a nutritional issue, and we move on to the next thing. But that again, that pattern of eating and the types of eating, and then are there purging behaviors going on that are not, those are not things people are necessarily going to volunteer. There's a lot of shame and stigma around that. And again, if you're not asking specifically those questions, you might miss it. But I do think that there likely is a lot of overlap in irritable bowel syndrome and disordered eating in general. And it's, again, it is a chicken or the egg thing, but it's important to tease that out because if you don't address the nutrition part, you're never going to get the GI part fixed.